What is the craziest myth you've heard online?
If someone has more sexual partners, you can tell because their vagina is looser. And I will tell you, my response is always, how would the vagina know how many partners? Whether you have one partner you have sex with 100 times or 100 partners you have sex with one time. It doesn't take attendance. There's no way to know. So that's definitely a myth. There's a lot of shaming that goes on with people when they say things like that. Do not listen to them. Sorry.
That's a lot of vagina math you just
Yes,
dropped.
exactly. So, vagina math does not matter at all. Live your life. Hi, I'm Dr. Karen Tang. I am a board-certified gynecologist, and this is Asking for a Friend.
How do you pronounce Kegals? Is it Kegel or Kegals? What's your hot take?
I pronounce it Kegals. I believe that's the right way. Most gynecologists I've heard have said Kegals. Kegel exercises are strengthening your pelvic floor. Now, the question is, do you need to strengthen your pelvic floor or do you need to relax it? Sometimes Kegels are good for problems like a weak pelvic floor, if you're leaking urine, then Kegels are great. Sometimes people have a pelvic floor that is too tight and painful. If you do more exercises, that could actually make things worse. It's just like if you have a back spasm and you go and you lift a whole bunch of weights, you can make your back spasm worse. This is where it's important to see a gynecologist or a pelvic floor physical therapist to figure out which you need and to point you in the right direction.
How do I know if I need to strengthen my pelvic floor?
I think everyone should work on their pelvic floor. Pretty much all women at some point in your life are going to have an issue with the pelvic floor, whether it's too weak or it's too tight and the function is off. Especially if you've been pregnant, if you've given birth, or if you're after menopause, the chances are that you probably have some issue with the pelvic floor. And that can include things like pain with sex, constipation, bladder urgency, or difficulty controlling your bladder. So if you're having issues with any of these, ask your gynecologist for a referral to a pelvic floor physical therapist or a urogynecologist. Those are specialists who help you manage these pelvic floor issues.
What kind of exercise is not good for your pelvic floor?
So a lot of things that are good for you in other ways can actually hurt your pelvic floor unintentionally. Running, spinning, lifting weights, anything that puts a lot of stress in your core or tenses your pelvic floor. A lot of people don't realize your pelvic floor is connected to your legs. It's connected to your back and your hips. Repetitive motions, straining motions can actually make your pelvic floor spasm or dysfunctional.
Can birth control pills help prevent ovarian cysts?
The answer is sometimes. So there are a lot of different types of ovarian cysts, and some of them are just from the function of your ovaries from releasing eggs. So if you prevent your ovaries from releasing eggs, you prevent those type of cysts. Now there are some types that you can't prevent, so that's where you would want to talk about that with your gynecologist.
I have really painful periods. Is this normal? How do I know what the signs are for endometriosis?
If you are thinking, are my periods too painful? The answer is probably yes. If you are having such bad pain that it's keeping you from going to school, from going to work, from enjoying the activities that you want to enjoy, like exercise or having sex, that's where you want to talk to your gynecologist, because it could be a sign of something like endometriosis, which causes very severe pain with periods and pain with things like sex or having bowel movements.
My doctor just told me I have a fibroid. How worried should I be?
Fibroids are incredibly common. In fact, they affect up to 80% of Black women and 70% of white women. So fibroids in a lot of people don't cause any problems. You can have them and have no problems whatsoever. But in some people, they can cause problems like heavy bleeding, pelvic pain, or pressure. Sometimes they grow so big, they almost make you feel like you're pregnant. They push on your bladder or the rectum. So if they are causing problems and you're having some of these symptoms, that's where you would want to talk about your treatment options. So fibroids in and of themselves don't increase your risk of cancers. The vast majority, over 99% of fibroids, are totally non-cancerous. And they don't affect your risk of ovarian cancer at all because they're in different places. The fibroids are in the uterus and the ovaries are separate. My favorite videos on TikTok that just make me laugh every time is the how many holes are there question. There's always some poor guy who just does not know how many holes there are, and they don't know that you can pee when you have a tampon in because they think it's all just one hole. There are 3 holes: urethra, vagina, and anus. They're separate. Yes, you can pee when you have a tampon in. Not everyone knows that, but that's why we're on TikTok trying to bust these health myths.
How many holes?
3 holes.